This bone here is clavicle. Clavicle is a modified long bone and it transmits the weight of the upper limb to the sternum. It is the only long bone that lies horizontally in the body and it is subcutaneous throughout. Clavicle is also known as the collar bone. How to determine the side of the clavicle? Clavicle has the medial end, which is quadrangular, and the lateral end is flattened. The upper surface is smooth and the inferior surface contains a small groove called the subclavian groove. The shaft of clavicle is slightly curved. On the medial 2/3 part it is convex forward and on the lateral 1/3 part it is concave forward. The clavicle is divided into three parts: the shaft, the medial end and the lateral end. The shaft is divided into medial 2/3 portion and the lateral 1/3 part. The lateral 1/3 part of the clavicle contains two surfaces, the superior surface and the inferior surface, and two borders, the anterior border and the posterior border. The medial 2/3 part of the clavicle contains four surfaces: superior surface, anterior surface, posterior surface and the inferior surface. When we look at the inferior surface of the clavicle, on the lateral 1/3 part we can find a tubercle called the conoid tubercle, and the trapezoid ridge is on the lateral side of the clavicle. If we see on the medial side, there is a small impression called the oval impression. This impression gives the attachment to the costoclavicular ligament. On the conoid tubercle and the trapezoid ridge, there is the attachment of coracoclavicular ligament. The lateral end of the clavicle is flattened and it forms the joint with the coracoid process of scapula, forming the coracoclavicular joint. The medial end of the clavicle bears a facet which joins with the sternum and the first ribs, forming the sternoclavicular joint, which is a type of plain synovial joint. Talking about the attachment of muscles in the clavicle, on the lateral 1/3 part, on the anterior end, there is the attachment of the deltoid muscles, and on the posterior end, there is the insertion of trapezius muscle. On the medial 2/3 part of the clavicle, when you talk about the attachment, there is the attachment of pectoralis major on the anterior surface. There is attachment of sternocleidomastoid on the superior surface of the medial 2/3 part, and on the posterior surface, there is attachment to the sternohyoid muscle. If you see on the inferior surface of the clavicle, there is a small groove on the lateral portion of the medial 2/3 part called the subclavian groove. Subclavian groove gives the insertion to the subclavian muscle. Just lateral to the subclavian groove, there is the nutrient foramen of the clavicle, which is not visible here. To determine the side of the clavicle, the medial end is quadrangular and the lateral end is flattened. The superior surface of the clavicle is smooth and the inferior surface bears a groove called the subclavian groove. On the medial 2/3 part of the clavicle, it is convex anteriorly, and on the lateral side, it is concave anteriorly. So, this is the clavicle of the right side, and we hold it on the right hand in the anatomical position.